Welcome to Startup Health Now, the weekly web show that celebrates the healthcare transformers and changemakers reimagining healthcare. My name is Stoakes, and we've got a great show today. We're actually shooting from Health Datapalooza here in Washington, D.C., and I've got the honor to be with two amazing healthcare transformers here from Babyscripts. So we got Anish, Sebastian, and Juan, Pablo, Segura. So great to have you here. It's going to be a great show. Stick around.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. But I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take.
So welcome, guys. It's great to have you here, and it's great to be connecting here at Health Datapalooza, and it's always good to see you guys. Just to kick things off, just to share with the audience, could you just share a little bit about your vision, your mission for Babyscripts, and what you're trying to accomplish?
Well, first of all, thanks for having us, Unity. Super excited to share what we're doing at Babyscripts. At the end of the day, with Babyscripts, our real hope is better pregnancies. That's what really drives us on a day-to-day basis. And what's really exciting is that patients, providers, just the health system in general has a lot more tools available and at its disposal to really move the needle in areas like prenatal care. So we'll talk a little bit more about our technology, I think, in a bit. But now that you're surrounded with things like the Internet of Things and smartphone ubiquity, what can you do to really change outcomes, to rethink the way not just doctors but patients approach their care? And at the end of the day, we want to improve that. And so that really is why we say better pregnancies.
Amazing. So just to back up and sort of frame who you guys are, right? You came out of consulting and finance, and now you're entrepreneurs. Maybe share a little bit about yourself and the arc to how you got to making this decision to become an entrepreneur.
Sure. Yeah. First of all, Unity, thanks again for having us, and welcome home. This is our home base here in DC.
Thank you.
But you're right. I did a lot of consulting at Deloitte, which is a large consulting company. We basically,
that's where you guys met, right?
Yep, that's where.
Back in the consulting days.
Interestingly enough, I was his supervisor when we first met.
That's why I made sure to get the boss to be the partner. So can't get bad reviews from that.
I'm still the supervisor. Let's not get that wrong. But no, I'm just kidding. No, but no. I mean, my formative job was, I just go to like a C-suite, whisper in their ear what to do, what not to do. Primarily when it came to IT risk. On the side, one thing that I got very interested in was the whole quantified self movement, right? In fact, I'm one of the organizers of the QS movement here in DC, and a self-proclaimed data nerd. And that's really what I am. And I was very fascinated with all this data that's being collected out there. But the question that I always posed was, what is the real clinical relevance in all this data, right? So fundamentally, when we jumped ship, that was a question we started to probe, which is, what is the real value of all this health data? How can you aggregate it together and find value in it, right? And that's what kind of started the company. And I know, Pablo, you have a slightly different angle as to what your sort of core calling was, but we both knew that we were going to start it. But why don't you share your background?
I mean, from my perspective, I come from a family of entrepreneurs, so I've always had the entrepreneurial blood in me. And also, us being millennials, it's we're never satisfied having to respond, or having to, at least on my end, having to respond to a boss in any way. So everyone wants to be their own boss, right?
You take like yoga 5 times
exactly.
a day.
Yeah. I like to think about
skinny jeans,
that's right. Existentialist at heart. But no, from our perspective, working at Deloitte, it's a great place. Consulting was a great job, but it never really allowed you to make a difference, at least in a tangible way, in your job. And I think that was the big thing that I kind of came to grips with, and I realized that, hey, maybe this isn't what I'm supposed to do. And when we both uncovered the opportunities.
So was there an aha moment then that you had, or both of you, that, hey, I'm meant to be an entrepreneur. I've got a bigger vision for my path?
I think the fact that I could never tie my work to, specifically helping one person or like furthering a specific goal. It was always just another cog in like the big machine of the client. I think was just not very satisfying, and everyone's different, but it came a moment, and I think a lot of it was tied to the beauty of the healthcare industry in general. You look at healthcare, if you're improving it, you're not just helping people make more money or be more efficient, but at the end of the day, you can always connect what you're doing to improving someone's life. Mm-hmm. And I think that was really what motivated us to get into this space in the first place. And then, you can start talking about all the opportunities with data and devices, and that innovation, it's touchable, it's possible, and Startup Health's always great about just discovering this new age, this golden age of entrepreneurship in healthcare IT. It is people like ourselves that didn't necessarily have a healthcare background, but had a mission. This is a place that anyone can make an impact if you've got the willpower and the resilience to stick it out. And we've been through that a lot.
I think that's one of the cool things is talent coming into this sector from outside of healthcare, mm-hmm. And really thinking about what needs to change in a different way, and thinking about the solutions in a completely different way. So do you feel like you both coming out from outside actually helped you as you got started?
Oh, 100%. I'll let you take that.
I mean, I remember going to my first kind of conferences, and about 90% of what people are saying were just like totally over my head, right? They were using a vocabulary that was very foreign to me.
Do you remember what we were looking at each other trying to figure out what a payer and a provider was, because we only knew what a health insurance company was?
Right. So I mean,
that's a little embarrassing. But
so the first like 2 to 3 months was just a total crash course, right? But with that, we also kind of questioned. It's like, well, why is it this way? Why are the incentives not aligned? I mean, what are the mechanisms, right? So, sometimes that out of the box thinking, it can be great, but sometimes you also kind of need to know the system, right? So the first thing we did was like, let's find all the advisors that know a lot about healthcare, and then have lunch with them constantly, right? So there a lot of lunch, a lot of coffees, but it was just like a crash course, right? So we got that knowledge, but at the same time, we were also questioning the entire time. It's like, well, what if we did this? What if we did that?
Does it have to work that way?
That's right. It's like, why is it so screwed up? No, I'm just kidding. But it's like, it's like, why is it this way, right? The why question. So coming from outside, we just constantly asked that question, which I think was fruitful for us. Ultimately, when we found what worked, it was because of that constant why, right? So that's something that definitely worked for us. Yeah, definitely.
Yeah, and the only thing I would add to that is, for a while, you might be the crazy young guys with bow ties running around kind of declaring that things need to be different. But
on brand, though.
Yeah, well, this is the Babyscripts bow tie.
Right,
but,
that's right.
But what ends up happening is there's that moment, and I think it happens in most startups' lives where, all of a sudden there is a doctor at a health system that's like, you're not crazy, and what you're talking about actually makes a lot of sense, and we can do that here. And I think that's been our story, where we were screaming at the rampart saying, hey, we can do this differently, and someone said yes, and then all of a sudden it's not just one person, but it's 2, it's 4, and then there is this mass effect that develops, and all of a sudden you're looking at scaling your company, and I think that's what started to happen with us.
So, what are the biggest things that surprised you from making the switch to being outside of the entrepreneurial sort of sphere, and then going headfirst into this deep dive you talk about for first few months, and really walking the walk and living your lives and building as an entrepreneur and building your company? What surprised you?
Yeah, I mean, I think the thing that I was surprised at the most was, even at the highest levels of a healthcare system, a payer provider, people had no idea what to do. I remember to this day, we were down in North Carolina and talking to the CEO of a hospital, right? And I went in assuming that he knew all the answers, he had all the solutions figured out, and even though he was the CEO of the hospital, he was just as lost as everyone else, right? So if he's lost, I got a shot. That's what I'm thinking. So we're like, well, what if I did this? What if I did this? And then the level of uncertainty in this industry right now, given the change that's going on, is striking, right?
So it's just creating this massive window of opportunity.
That's right. I mean, with the more uncertainty there is, the more window there is for opportunity, right? And I know Steve calls this the golden age of healthcare entrepreneurship. Well, that's a great kind of marketing line. At the same time, it's really true, right? They're all trying to figure this out, right? And the hottest thing in healthcare right now is mobile digital, right? I mean, that's like a done deal now. It's not questionable anymore, right? So, once we kind of figure that out, it's like, well, we can actually take some of our initial successes and attest a level of expertise in this, right? And then they're listening to us, and they're giving us the phone call, right? So that, just kind of seeing that transformation, I mean, wasn't that just impressive?
It is cool when someone in the industry, has been in the industry for like 40 years, comes to you and says, can you teach me about, this whole area? And you're like, wait a second. Like,
I came here
a
to
year,
learn from
like
you.
30 years ago. Yeah. And
Yeah.
so that's great. And kind of on the flip side of what Anish is talking about, which is like this void that needs to be filled in the space, we look at one of the most surprising things for me was, as an outsider looking into the world of entrepreneurship, you admire companies like Facebook or some other maybe like West Coast Silicon Valley companies that don't have corporate structure or kind of do things on the fly and are able to like build incredible things. But then when you come into the entrepreneurial circle, you actually realize that they're not doing everything, there aren't loose ends. I mean, there's structure that needs to be built. There's a reason why, at your consulting job, you were doing like, year-end reviews, and you have a sales pipeline, and you have HR, because all of these little things matter. And structure, discipline, having a plan. You can't just do things one-off. You actually have to spend time building everything out so that you can scale. And I think that those are the things that you don't really appreciate when you're first starting, or at least when you're outside. But when you're inside, you're like, holy cow, if I don't organize myself, I'm in big trouble.
So a couple of lessons learned. What wisdom would you pass off to fellow entrepreneurs or other entrepreneurs just getting started, or maybe other people who are sitting at Deloitte thinking, wow, I want to take this leap. I want to be an entrepreneur. What would you say to them?
I'll take the first stab at that. I think the one thing that keeps coming back, and it resounds to be true to this day, from the second I left Deloitte to what we're doing now and trying to grow our company, is that you have to invest in A players. And when you try to build your team, because there comes a moment in growing your company where the founders can't do everything themselves, and you need to start bringing on employees, other partners, and you can never settle. And I think a lot of companies fail because they try to get something done quickly, and they don't think about how hard it is to actually succeed. And so if you have good people, whether it's a technology team, whether it's a sales force, people that you can trust, people that can produce results, there's the old mantra that A players hire A players, B players hire C players. And kind of organizationally, if you're not focusing on your people, then you're not going to succeed. I guarantee you 100% of the time. And so that's something that like you kind of have to really bite the bullet and spend more time. If someone's not working, you need to just get rid of them and go to the next one. And I don't mean to sound ruthless, but I mean, you only get one shot at this, and you've got to do it the right time. You got to do it the right first time.
Yeah, I mean, totally agree with everything you're saying. The other thing that I would add is, don't ever let the perfect be the enemy of the good, right?
So ship early and often.
Ship early and often, because no matter how awesome you think your app is, it's probably not as good as you think it is, right? And let the market and the users decide what's good and what's bad, right? So just keep putting it out there, let it get beat up, let it get torn up, learn from it, which is very much in the iterate quickly. But that's true about every facet, business model. Try it. Does it fail? Does it work? Keep moving, right? So
this is a good transition to, I think you guys did a really good job at transitioning your own business, right? You started as One EQ, and you're now focusing on Babyscripts and sort of pivoted to that focus. Maybe talk about that transition and why you did it, and what the benefits have been
You
so
should,
far.
You should mention the realization we had after the showcase in San Francisco a year ago, where so we, for those that don't know the corporate structure of Babyscripts, what it was back a year and a half, 2 years ago, and what it is now, we used to be a consumer, essentially like a
Data aggregation.
data aggregation play, and we realized that we weren't getting a lot of traction, and we really rethought how we could not just generate revenue, but build a scalable business model. And we pivoted into obstetric care and more remote monitoring using the same data points that we were collecting back at the 1EQ days, but now just being able to focus in on one area and deliver a lot of value in one place.
So there was a link between the two.
yeah.
just
There
to
definitely was.
refocus.
Yeah.
The core foundation of the company, and even some of the code base was the same, right? We just sort of said, what is a pressing pain point in the market that can get us started, and we tried a whole bunch of things. I mean, we must have had, gosh, I don't even know.
We tried to go cardiology, endocrinology,
Sleep medicine.
Yeah, sleep. And the interesting part though is the fact that like once you find somewhere that has promise, you've got, since your startup, or if people watching are related or somehow connected to a startup, you've got to focus in on one area, and you can't be all things to all people. And I think I was bringing up that moment after JP Morgan conference, because we went up after one of the showcases, during the showcase, and I did my 59-second pitch, and I talked about like this grand platform that could consolidate all this data. And right towards the end, I mentioned that we were doing a pilot in obstetric care and pregnancy care. And Anish pulls me aside and goes, "You know what? We're a pregnancy company now." And it didn't hit me till around 2 months afterwards, and it didn't hit us as like a company. But 2 months after that moment, we got rid of every other potential pilot that we were pursuing in other areas,
You just
and we focused
like a laser.
And that's
on
actually
pregnancy
a
care.
really important point.
Yeah.
At some point, you stop pivoting and you start refining and focusing, right? And we're still going through that process, right? I mean, I don't think we're necessarily pivoting
And
anymore.
how do you describe the value proposition today of Babyscripts?
Right. So Babyscripts is a technology platform that essentially enhances the care that the obstetrician delivers. Right. We focus on patient engagement, patient satisfaction, and more importantly, we're able to automate and remotely monitor a lot of elements of low-risk pregnancies. So that causes a lot of
the
operational.
patient is the user, but the doctor or provider is really
the customer.
Is the customer.
That's
Yeah.
right. Yeah. The OBGYNs, they're a customer, but the end user is the patient. Yep. That's right.
Yeah, so the patients get, we call it the mommy kit, and we usually have one around us. But
It's the big pink
yeah,
box.
it's this big pink box.
What's in the mommy kit?
It's a wireless
Actually-
blood pressure cuff. Well, maybe we can grab it or
Yeah.
not.
Yeah,
someone can bring it
Let's see
over.
if we can
One
grab
over.
it. Yeah, exactly. We always have it handy. I don't leave home without it. Here's
the camera?
mommy kit.
There you go.
You gotta display it this way.
There we go.
There you go.
I remember you held that up on stage
Yeah.
at JP Morgan Healthcare last year.
3 months ago.
Oh, 3 months ago.
Yeah, or
Yeah, and the
6
crowd's been
months
wild,
ago.
so.
Yeah, we unveiled it for the first time publicly. But no, so we actually deliver this kit to expecting mothers from their doctors. So their doctors actually prescribe our solution like a drug to their patients, and then they get our solution. It's both an app in this box, and inside is a scale and a blood pressure cuff that are connected to the internet. And so through the experience of using the devices, the app, we're able to remote monitor the mother. And if anything's wrong during the pregnancy, we actually alert their doctor in real time so that the doctor can intervene. And really, the interesting thing is how we've gone to market is we haven't said, okay, we're going to work with payers and improve healthcare outcomes, which is most first-time entrepreneurs' tendency in this space is to try to go for value and this whole ACO value-based healthcare system. But we actually are simply eliminating in-office visits for the doctors, since we're capturing the same data that's usually captured in the clinic at home. And because doctors, a lot of people don't know this, most pregnancy care is paid with global fees, which are lump sum payments. They're actually able to be more efficient in managing the pregnancies, and they actually make more money by not seeing the patient as often. So it works on both ends, and that's really how we've kind of targeted this niche.
So it's interesting that two men are focusing on a pregnancy solution.
Hey, most knowledgeable bachelors in pregnancy matters in the world right here.
Yeah.
Yeah.
How have you, obviously, one of the things we're trying to do at Startup Health is inspire more women to become entrepreneurs and doctorpreneurs, and I think about a third of our companies are run by women. How have you guys sort of gone out and talked to either people who are pregnant or sort of worked that into your process to really understand the needs?
So it's to your point, if two sort of bachelors kind of talk about pregnancy, it's not really going to be in our favor, right? So we really let the OBGYN and actually the patients themselves do the talking for us, right? So we do a lot of focus groups, kind of case studies. People don't know this, but OBGYN is the area of residency, area of medicine where it's predominantly female. So if you look at a resident class graduating today, it's like 90% female, as opposed to like surgery where it's like 80% male. Like typically a lot of the other specialties are like that, right? So, we kind of sort of step back and move into the back and let the product and the users of the product really do our talking for us, right? So that's helped. We also have female employees now, that's also been helpful. So at the end of the day, we're kind of building a story, right? And a story that this is actually enhancing the experience of pregnancy.
And I will add that one of our employees actually is pregnant and on the Babyscripts program.
Oh.
So it's great to get live feedback in the office, and as well as just, this is something that we want to encourage, and obviously we're providing it for free and everything else. But it's great to just kind of include that in the culture.
So one of the things I know you guys talked about is really the human experience of data, of technology. Could you talk a little bit about that and what that means?
Sure. Yeah. We've now abbreviated that to HUMX. UX is
TM. That is a Babyscripts concept.
Right. So UX doesn't exist anymore. It's all about HUMX. We think that technology should be so ambient in nature, where it just fundamentally is within the fabric of the human experience, right? I'll give you just one example. In our case, we have the scale, right? It's exactly like in every other scale that you ever see, right? You step on it and then you go to work, right? The only difference is we can collect the data from it, right? But there's no additional work that the user is doing, right? The Amazon Echo, which just came out, is another good example of it, right? Where we think technology is going is outside of an interface, right? It's like embedded into your everyday life. The Apple Watch, another good example.
Designed right into your life.
That's right. You look over it and you get, there's an email, right? You don't need a computer. Eventually you don't need a mobile phone, right? It just comes to you, right?
Or even concepts like behavior change that are very kind of, it's not cliche, but they are used often in the space, and you need to redefine that so that you're not necessarily doing a huge. There isn't a moment where everything changes. It's just part of your life, and that inclusion is what ultimately changes your behavior in a very ambient way.
And the other side of HUMX is incomplete without really the data science, right? Because when you have a purely human experience or in technology, you're going to collect a lot of data, right? So we've been now kind of like working on concepts like data science as a service and that type of thing. The idea is, when you have a purely human experience, you're going to collect a lot of data, and then you need to quickly be able to kind of refine, look at that data, and see where the value is in that data, right? So data science and human experience kind of go hand in hand.
Absolutely.
And that's like a really exciting intersection to be at.
So what are you guys most excited about, just to wrap up here, what are you guys most excited about in the future? What's coming? What's getting you excited?
Well, most people will be like, oh yeah, the big Series A, and that's always a good thing. But I'm excited to hit 1,000 pregnancies that will have used Babyscripts by the end of this year. We've already gotten some great stories about interventions.
And you're working with several great partners already.
Yeah, we're really. It's interesting. We've taken our growth as a company, not just it's a cash flow projection, and you're trying to hit numbers, and you're trying to create a lot of value, but you're also trying to change the way people think about just this whole space. And we've gotten some great stories, but with 1,000 pregnancies, I want to save lives, and I think it's going to be clear from being able to do this with so many people that we're going to have some stories that are going to be game changing, and so that's what I'm very, very excited about. And I think again that is the draw of this space. It's not just making money or getting a bunch of downloads. It's hey, I'm actually improving someone's life, and that's powerful stuff.
Yeah, absolutely.
Yeah, I mean, just to kind of enhance that or add to it is, having one customer is very different than having 20 customers, right? Having 100 patients is very different than having 10,000 patients, right? So we've fortunately gone past that stage of having 100 sort of patients or one customer, right? Now we're in the building phase, right? The challenges in that initial stage is just as difficult as the challenge of the next one. They're very different in nature. Now we're building infrastructure, right? Now we're building like the roads and bridges of a company, right? We have employees now. We have a sales force. We have product. We have development. It's all this stuff. So still very interesting challenges, but very different. And that's exciting. That's exciting. That's literally why we decided to jump ship from the good old Deloitte days, right? So,
thank you both for doing what you do and for being healthcare transformers. I think we need more people to come from outside of healthcare into healthcare and become entrepreneurs and really reinvent the future of every aspect of health and wellness, and pregnancy is certainly an important part of that. I just had a young son, 8 months old now.
Yeah,
and I know that a technology and solution like this would have been very meaningful to us during our journey. So thank you for doing what you're doing, and thank you for being here today.
Thanks
Thank
for
you.
having us, Unity. Appreciate it.